All right, I'm going to be demonstrating rib balance ligamentous tension technique. And so I find this is a fantastic rib technique for people that are coming in with chronic rib pain, notably people that maybe cough the rib out of place, or they've come in with a chronic costochondrosis, costochondritis kind of condition. And so this is really good for people that are having rib pain that might be on the anterior kind of aspect or maybe on the posterior aspect. And there's variations that we can do so that we can address both sides. And so balanced ligamentous tension, in this case here, what we're trying to do is we're trying to distract the rib from its respective connections. And so that would be from the costochondral kind of articulation anteriorly and from the costotransverse articulation posteriorly. So what I'm going to be doing is I'm going to be kind of contacting the rib. So let's say that I'm trying to get the rib right down here, just below, right over here. Now, he's a male patient right over here, so I don't have to be as cautious when I'm over this area, but just so that I'm not getting kind of invasive on any kind of female patient, what I will do is with their contralateral hand, so with your left hand, with your left hand, just kind of hold up your chest right over here. So let me have you just kind of do that. Okay, and so that's what I'll have a female do, just to kind of get the breast tissue out of the way. That way there's just no impropriety, and so I can also allows me better access to be able to get on the ribs, because I see a lot of ribs that happen to be right on that bra line, right in this area, right over here. So I'm going to be kind of contacting the rib of dysfunction right over here on the anterior aspect, and I'm going to be finding it on the posterior aspect. One way that I find that's helpful is, like, very often they're complaining, like, yeah, that's the rib, that hurts me on the front. Am I on the correct rib on the back? I'll start with just kind of my hand, just kind of generally on rib, and then I kind of seesaw that first rib over on the front until I feel like, where do I feel the motion? Oh, okay, I feel the motion right here on my pinky finger, on my ring finger, and so then I'm like, okay, let me kind of just lock my fingers kind of around that rib on both sides on that respective side. So again, I'm going to contact right over here. I'm going to find my rib in the back right over here. Then what I'm going to have them do is take your right arm, and I want you to relax your right arm on top of my arm right here. Okay, yep. So it just allows him just to be a little bit more passive. Okay, and then what I'm going to be doing is I'm going to kind of try to pinch the rib. So I'm pinching the rib in between my fingers over on the back and pinching the rib on the anterior aspect on the front. And then I'm going to be applying a distracting force. So I'm trying to kind of take a distracting force away on both the anterior and posterior, trying to separate that rib off there. Okay. Okay, so I'm trying to separate that off, and then if it's more of a problem on the anterior aspect, I'm going to have him turn his torso away from me a little bit, so turn a little bit away. And when he does that, in addition to the distraction force I already have, it has created a little bit more distraction on the anterior aspect, and so again, just helps me accentuate it a little bit better. Okay, and then when he takes a breath in and a breath out, I see which phase it likes to go. And I see most of these ribs, they cough them out of place. A lot of times it's an exhalation dysfunction. So let's assume it's an exhalation dysfunction. So take a breath in and then out, and then hold it out as long as you comfortably can. Okay, so as he holds that out, I'm again maintaining that traction force anteriorly and posteriorly, guiding it a little bit further into exhalation kind of dysfunction, kind of bringing my hands down, down in the front, up in the back, just to kind of help guide that a little bit further, until I feel it kind of release itself. Now, conversely, if it's more posterior kind of rib dysfunction and we want to focus more on the back end there, go ahead and pivot for me over that way. Okay, so instead of having them turn towards me or away from me, I'd have them turn away. I'd have them turn away from me. So I'm contacting the rib in the same kind of respective spot over here, having them relax the arm. Now turn towards me. So he turns towards me. Now that is creating some tension on the posterior aspect right over here, which helps me gap it a little bit more on the posterior. I'm still providing anterior and posterior traction forces to get that rib free floating within the myofascia as much as possible. But I find that that little turn that they do really makes a big difference. Not so exaggerated that you're just kind of like feel like you're starting to skin drag off of them, but enough that you feel like you're kind of gapping that rib, just enough that you're taking the tension off of that joint, so you get balanced ligamentous tension.